Hello and welcome. I'm Joanna Junak and this is GFN News on gfn.tv. Tobacco harm reduction is an approach that has gained significant attention globally as it offers a promising alternatives to traditional smoking cessation methods. Dr. Ziauddin Islam, our guest today, is a global public health and tobacco control expert, leading advocate for tobacco harm reduction, former technical head of the Tobacco Control Cell, Ministry of National Health Services, Pakistan, and former focal technical representative of the government of Pakistan to the WHO FCTC and ITP. Together, we will explore the current state of tobacco harm reduction in Pakistan, the challenges faced, and the potential impact it could have on reducing smoking-related harm in the country. Hello, Dr. Zia, and thank you for joining us today. First, could you tell us how your journey with tobacco harm reduction started, and what some of the key initiatives you've worked on are?
Thank you for having me for this nice opportunity to express the tobacco harm reduction work in Pakistan. Actually, my journey starts with the one outstanding goal: to save the life of millions of smokers with the support of harm reduction. I've been working as a technical head of Ministry of Health's Tobacco Control Cell for more than a decade, and I'm honored to serve Pakistan's focal technical representative in the WHO FCTC's and illicit trade protocol. Yeah, regarding key initiative, yes, I shaped in my long stay in the Ministry of Health, National Tobacco Control Policy. We try to follow the Empower strategies in the light of FCTC. I always advocate with balanced tobacco control regulation. I publish many articles, blogs for the tobacco control, tobacco taxation. But recently, as you know, I'm a very strong proponent of tobacco harm reduction. So this is my area. I think Pakistan is lacking, and then we need to work on the tobacco harm reduction. Yeah.
And how do you define tobacco harm reduction in the context of Pakistan, and why is it important?
Tobacco harm reduction is very vital for the tobacco control elsewhere, and like elsewhere in Pakistan, where 30 million users smokes cigarette. With the health cost burden is more than 615 billion Pakistani rupees, is 1.5 GDP ratio of Pakistan. And this, let me tell you, this was the survey finding in 2019. If I can give a projection, so I can confidently say it's more than 1,000 billion Pakistani rupees is the health cost burden of tobacco-related disease. For many, especially in rural and low-income countries, quitting is tough due to addiction and limited support. THR offers great support, lifeline support by reducing the harm with the help of a safer alternative. I think in the context of Pakistan, I define harm reduction is a public health strategy that can prioritize the reducing the harm caused by the tobacco by producing safer alternatives like vaping, e-cigarettes, snus, nicotine pouches, for those who cannot or do not wish to quit the nicotine.
So, what is the state of education around tobacco harm reduction?
We are very unfortunate in this arena. I must say, THR is in Pakistan is there for some time, slowly advancing. Despite reduced limitation, scarce grant, less support from the government, and pervasive misinformation, like billionaire philanthropists is exerting pressure with these grants with the help of their grantees. So scarcity of the funding, regulatory uncertainty, misinformation, actually these are the main areas which hinders the progress. I am working for advocacy. I'm focusing, promoting the safer alternative nicotine product and campaign to debunk the myths about this THR. Despite without any funding, without any support from elsewhere, I still managing raising my voice with the for the support of the THR and for the people of the Pakistan.
Based on what you've said, do you think people in Pakistan are properly informed about alternatives to traditional tobacco products?
Yeah, it's a beautiful question. I'm encouraged that the Pakistani people, Pakistani youth, especially those living in the urban areas, in the Polish area, they are getting information. They themselves literating what is the THR going on elsewhere in the world. Like we have the good example of UK, New Zealand. We have the good witnessing the good success in the USA, which was, witnessed by the CDC data that it is good progress over there. But growing media exposure and public interest, yes, they are the positive step. But we are lagging behind the rural areas and unprivileged population. There we need to do work for advocacy, for awareness. And this is not only advocacy for the people. Actually, we need to focus for the regulatory framework. Unfortunately, THR is not in the context of tobacco control policies or regulation. All is focused on FCTC related regulation of the Pakistan with regards to tobacco control.
So, what non-combustible tobacco products are used, and what safer alternatives can people access?
We have the range of series. Starting from traditional smokeless products, we have the Naswar. Many parts of the Pakistan, especially in one of our KPK province in the Punjab, in the Sindh, they use Naswar, putting something inside the cheek, like this oral nicotine pouch. This is a modern presentation of this Naswar. We have local pan masalas type things which they used to put inside the mouth. Yes, regarding novel nicotine product, we have everything available in the Pakistan, ranging from the oral nicotine pouch, Velo, Zin, and these are easily available around the Pakistan. We have the vaping, we have the HTTP products. So we have the long range of these products, but still they are not in the regulatory framework. We need to make some regulatory framework to make these products with certain standards. Standards like the case of Evali in US a long time ago, which there is adulteration of these vaping products. So we can understand that if there is no regulation in Pakistan, there can be the chances of adulteration of these products.
And do you see any barriers to the adoption of reduced risk products?
Yeah, there are a lot of barriers. We have the limited awareness of their benefits. As I earlier mentioned, there is no government support, no civil society working for promoting the benefit of the THR. We have the gray area, we have inadequate regulatory measures, insufficient government. High cost of vaping product is the main concern as compared to combustible cigarettes. Yes, they are really not in the par with the cigarette. So we need to consider how we are going to have this vaping product alternative for those who are using combustible cigarettes cheaper than vaping. Cultural resistance and definitely misinformation we cannot rule out is a very important barrier. And prohibitionist tobacco control, traditional advocate like everywhere in the world, they are also exist in the Pakistan. So they are actually one of strong barriers for getting people understand the reduced risk products efficacy.
One last question, Dr. Zia. How is tobacco harm reduction connected to tobacco control policies in Pakistan?
Actually, we have the two laws of tobacco control in Pakistan, and one is 2002 ordinance, and the other one is 1979 ordinance. You know, at that time, THR was not existing. I can say it's not formally integrated in the Pakistan tobacco control policies, which basically focus on the empower strategies and FCTCs. Although we ratified in FCTC in 2004 and we developed Ordinance 2004, but it's all related and encompass the FCTC and empower. Lately, in 2020-22, Ministry of Health, which is overseeing body for the tobacco control, pass a statutory regulatory order in favor of HTTP, first of its kind in Pakistan. But still, I mean, although it allows, but we need to have more THR incorporation in the existing tobacco control laws of the Pakistan for proper information and dissemination of information.
Thank you, Dr. Zia. That's all for today. Tune in next time here on GFN TV or on our podcast. And make sure to check out our social media pages for the latest updates on this year's Global Forum on Nicotine conference. Thanks for watching or listening. See you next time.